The gallbladder. What is it?
I mean, some people might describe it as a useless sac, um, kind of like how some people might describe like their husband or something. But
I was going to be kinder and say it like the spleen or the appendix. Like, do we not know what it does? But you go there, girl. You go.
the information shared on this podcast is for general educational purposes only and reflects the host's personal views and experiences. It does not constitute medical, legal, or financial advice, and no professional relationship is formed by listening to this podcast. As always, consult your own qualified advisors regarding your specific needs and practice. Thank you.
Hi, Dr. Soyka.
Hi, Sonia.
Hello. Today we're talking about the gallbladder and the liver, which I actually have two of them, but I don't know exactly
You
what
have
they
two
do.
livers?
So, I mean, I have one of each, but I'm not sure what, their function and purpose is. So I'm quite excited to learn a little bit more about each organ.
Good.
And how they contribute to our beautiful human body. So let's start off with the gallbladder. What is it?
I mean, some people might describe it as a useless sac, kind of like how some people might describe like their husband or something. But
I was going to be kinder and say it like the spleen or the appendix. Like, do we not know what it does? But you go there, girl. You go.
so it's essentially a sac, and it holds extra bile. And bile is basically a liquid that participates in the digestion process, specifically digesting fats.
Okay.
It doesn't really have much more purpose than that.
What color is bile?
Yellow. Come on, you've definitely thrown up bile or pooped bile.
Oh, wait. See, we can poop it and we can throw it
Oh,
up?
yeah. Come on, you've never thrown up like yellowy green bile?
I mean, I've never looked at the anatomy of my vomit, but I'll look at it now. It's usually just whatever I threw up. But what's going on? Those liquids are coming out with us as we expunge?
Well, yeah, bile is being secreted from the gallbladder or the liver actually. So bile is made in the liver, and then the excess bile is stored in the useless sac, the gallbladder. And when you eat fat or a meal, it triggers the secretion of bile. And so there's always bile coming out into the intestines from the liver because it's always being made. And then when there's a big ingestion of food, the gallbladder like squeezes out extra bile. And so it's all connected. The liver and the gallbladder are connected through something called the common bile duct. And that inserts itself right into the duodenum, whatever shall it be named. And it empties right into there.
So before we get talking more about download with bile, what is a liver? Let's get a running definition of the difference between both and what are
Your
the
liver
organs.
is essentially your body's detoxification system. So blood flows into the liver, and that's where it's filtered. And then it comes out of the liver essentially filtered. The liver also, like I said, creates bile, and it's secreted through the small bile duct channels in the liver and eventually into the common bile duct and the extra stored in the gallbladder.
But we need our liver. It's not useless.
We do need our liver. That's why when you start having liver failure and things, you get, like people say, toxins build up in the blood because that's what happens, literally, because your liver cannot filter them out.
So when they're checking my liver on a blood panel, they're checking to make sure there's no toxins in there?
No, They're checking to make sure it's working and checking
Mm.
to make sure it's not inflamed and there's no signs of any blockages in any of those ducts within the liver.
Mm-hmm.
You assume if your liver is functioning and the enzymes are fine and all of that, that it's processing the toxins. You don't have to measure the byproduct to prove its functionality.
And how many ducks are in there?
I don't know, hundreds, thousands, lots.
Okay. Okay, so we've got the liver and the gallbladder. The liver we need, the gallbladder. Like you hear people have gallbladder removal surgery. Is that accurate? I see it on Grey's Anatomy a lot.
Yeah, so what happens is like the gallbladder becomes a problem when there's a lot of bile in there that gets stagnant and stays, and it's what we call stasis, like it just sits there when there's a lot of bile,
Mm.
and then it can form stones, like what we call gallstones. And gallstones are problematic. They're like little, they start as like sand and then they become pebbles or rocks. And obviously, like these ducts are very small. They're like the diameter of angel hair pasta, like they're really skinny. And you can't have a pebble fit through angel hair pasta, right? It's too small.
Mm.
Um, and so that's when people get like the ducts are blocked and the gallbladder can get infected, and that's when it needs to come out. So, like
Now I'm getting
when your
hungry for
gallbladder is
pasta.
sick, like your both of these sit right up here in your what we call the right upper quadrant, like right underneath your rib cage there. Your
Mm-hmm.
liver is generally not a symptomatic organ. So when people say like they feel their liver, that's very uncommon. You shouldn't feel your liver. It doesn't have sensory input, but your gallbladder definitely does. And so when you're like what people would say gallbladder pain, or the medical term would be symptomatic cholelithiasis, is essentially right upper quadrant pain, nausea, usually after eating, especially a fatty
Mm.
meal. And then when it's infected, you can add in fever, vomiting.
Mm.
That's when it really is a problem.
What's a fatty meal, in your opinion?
It doesn't have to be bad fats. Like one time I had a patient coming who was really eating all these avocados. And even though they're healthy fats, they're still fat. And the gallbladder can't
Mm-hmm.
tell the difference. So fat, it was secreting, it was causing a lot of issues for her. But a fatty meal is something generally, like people will notice, like with a lot of cheese or something fried
Mm.
or something very oily.
Okay. Okay. So if we go back to the like actual gallstones, you mentioned sand, pebbles, rocks. I feel like I'm at the beach. I feel like my gallbladder could be its own beach right now. Um, what's the remedy? Like, how do we prevent gallstones from developing?
Well, you can start by, eating a lower fat diet to begin with. The less activity of the gallbladder, like the less fat people ingest and the thinner they are, the less likely they are to have gallstones. That being said, there's a
Ah.
lot that plays into it. A lot of people have gallbladder problems that run in their family. So there's definitely a
Mm-hmm.
hereditary component to gallbladder issues. Um, Being a female increases your risk. Gallbladder issues are more common in females than men. Probably a hormone related thing because it actually also
Mm.
increases um, like gallbladder disease, and the rates of people needing gallbladder resections increases in women in their 40s. So that's right around that funnel menopause time. So there's clearly
Mm-hmm.
some sort of hormonal factor that plays a role in gallstone formation. Um, and it's also increases as visceral fat increases. So the more fat we carry around our middle, the more likely we are to have gallstones.
I do keep an extra 5 pounds or 10 pounds there in case of emergency when I have a flare. When I have a
I know, but
flare.
it's true though, right? You need like a backup. I
Yeah.
was telling this to someone yesterday, a patient who was like 1 pound overweight, who was like perseverating on it. And I was like, you need a bit of a backup plan. Like you need something in reserves. What's on the shelf if you get sick?
Yeah, or if you get like stranded on a deserted island, you need
Right.
something
Like,
to
what if
like,
you all of a sudden have to go on Survivor tomorrow?
yeah, I know, right? I like it because when I inject myself with the Stellara, I just need a little love handle to grab on there, like some adipose tissue to just clock in that needle and it hurts less. I'm like,
I
yeah,
agree.
go in there. Yeah, go in there. But I also wear maternity jeans because it doesn't hurt the gut that
Get
much.
in the
But yeah.
hole.
Okay, so a less fatty diet, you can feel pain in the gallbladder, not necessarily the liver. And then what's it like when you do have a gallstone? Is it like what they say with people who are trying to pass a kidney stone, or what's going on there?
No, I mean, yes and no. So both of them are stones stuck in ducts, but they're in different duct
Yep.
systems, right? So, like I said before, it's those symptoms of nausea, vomiting, abdominal pain, fever if things are really blocked and getting infected at that point. That's
Mm-hmm.
when the gallbladder needs to come out. The other issue to always figure out, and as a gastroenterologist, is always like the question, because I'm not a surgeon, right? So I can't operate on patients, but there is this thing that can happen where your gallbladder can actually get the gallstone out, but then it
Mm.
gets stuck in that damn duct. And when it's stuck in the duct, that's either called choledocholithiasis, which is the world's longest name, or cholangitis if it's really infected and you're really sick. And that's a whole nother skew of problems. So not only is the gallbladder problematic in that setting, but the bile ducts are problematic. So there's a whole host of ways to get the stones out of the bile duct, but suffice it to say that's kind of like a gastroenterologist's worst nightmare, because stones in the bile duct, people get sick quickly and they're hard to treat. And
Mm.
so we're always like, keep the stones in the sack. Don't be a useless sack. Don't get it
Yeah.
out and then get it stuck in the duct. That doesn't make any sense, useless sack.
So instead of being a thorn in my side, I could say you're a stone in my duct.
You could, and I would very much
Uh.
that would resonate with me deeply. Or like
Uh,
you're a food bolus stuck in my esophagus.
a food bowl is stuck in my.
No, a
What's a
food
food
bolus.
bowl?
So like it is the gastroenterologist's number one like worst nightmare call all the time is what we call food boluses. And that's when somebody is eating and the food gets stuck in their esophagus because they don't chew it well, whatever. They take too big of bites. It's always like a hot dog or a piece of steak or something. And it's always at midnight, like always. Inevitably, there is no other time you will get called about a food bolus. You will only get called from the emergency room at midnight for a food bolus. Always, every time.
Yeah, Dr. Kareem told me about the number of like I don't know what y'all do when people don't chew their steak, but how do y'all get it
Oh,
out?
there's lots of ways. Like if you can't push it down, there's probably like at least 10 to 12 tools that we can use to try to pull it out the other way, like up through your mouth.
Okay, so the PSA message there is chew your steak
Yeah,
at
I used to
least.
work with this older gastroenterologist who said on his tombstone, his epitaph was going to say, chew your food. Here he lies,
Wow.
chew your food.
Chew your food. So don't be a food bolus in your esophagus. Okay, I gotta keep that one. Look at all this new vocabulary. Or what does Dr. Wynn say? She's like, I was gonna tear that person a new orifice.
I like it. That's a nice way of saying it.
Yeah, I like that
I
one.
like the
I
word
like that one a
orifice
lot.
too.
Oh, orifice means
That's
hole,
right.
right?
I liked it. One of my
Hole.
famous phrases, because people, I think it's hard to like understand if I'm a surgeon or like what I do, because like colonoscopies are not really a surgery, they're a procedure. And so I like to explain it to people by saying, I only use holes that God created for you. So I'm not out
There's
there
some
like
holes
wielding
that we could shut.
scalpels, making cuts.
Yeah, 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 yeah. I was just like, I wish there were some holes we could like zip for sometimes, Look at me dreaming away here while we're talking about gallbladders and
It's so
gallstones.
interesting that the
So,
gallbladder is what makes you pontificate life.
you know, thank you for bringing that up. I like the word marinade. I'm marinating about life right now. And I don't know, gallstones, gallbladders, liver. I've always wanted to know what they do because you always hear people are having their gallbladder removed. And I'm like, wait, is there no research confirming that we don't need it? Like the spleen, the appendix? Where are we at with the spleen and appendix these
Yeah, I
days?
mean,
Do we need them? Do we not need them?
living without a spleen is harder. The appendix you really don't need.
Okay.
But the spleen plays a role in immunity and cells. So without a
Mm.
spleen, you're at much higher risk of certain infections and disease. So you do need a spleen. I mean, you don't need it, but
Uh,
like it's definitely life is better with a spleen.
life is. See, there's another tagline. Life is
Hashtag
better
life
with
is.
this.
I wonder if there's any like splenologist. That's not really like a medical specialty, but there's got to be somebody in this world that like considers themselves a specialist in the spleen. And maybe
In
we
the
could make like
spleen.
one piece of merchandise for them. Hashtag life is better with a spleen. Please let us
Eh,
know if you are a splenologist and we can make you a t-shirt. I will. If you are a splenologist, please reach out. Comment below.
or yeah, a spleen specialist. That's a hard thing to say
I have
twice.
decided to
Spleen
call them
specialist,
splenologists.
splenologist. I like that. So, net, the best way to take care of your gallbladder. But when they do surgery and are they removing your gallstones? They're not removing your gallbladder. What are they
Yeah,
removing?
they take the whole sack out. It's like a balloon. It looks like a balloon. Like a and
Okay.
the stones are inside the balloon.
Okay.
Unless they're
So
stuck
we
in the
really
duct,
don't need.
So what they do is like, have you ever seen a balloon like here's the balloon part and then there's like the bottom part that you tie. So consider that bottom part that you tie like the duct. It's called the cystic duct.
Mm.
And they usually put like two clips right in the middle of that duct and then make sure that there's no spillage, no biles getting through, everything looks good, and then they cut right proximal to those clips, and then they pull the
Mm.
sack of stones, usually if it's laparoscopic, right out through your belly button.
Ooh. Ooh. I've had laparoscopic surgery before on the excuse me, the Da Vinci
Yeah, that's a
machine.
robot.
The Da Vinci. Oh yeah. I had cysts on my ovaries and Dr. Shea was like, we need to take them out. I'm like, sure, sign me up. When are we doing it? She's like, next week. I'm like, how many times have you done this? And she's like, once, a couple of weeks ago on a pig in San Jose. I'm like, all right, I'm your first human.
Really?
She's like, yeah,
You signed right
this was
up. You
back
signed
in,
right up for that.
well, she was the most amazing physician on the planet. She's no longer with us, but I wrote her a whole poem. And I guess a bunch of doctors came to see me in the recovery room because I was the first female in the hospital that had been operated on with the Da Vinci laser
That's
machine. And
cool.
I was like, a pig, huh? And she's like, a pig. I'm like, well,
Now
okay.
any hospital worth their salt's got Da Vinci's. Now we all have them.
Yeah, back then, excuse us, we have to make sure we don't have dry
Yes, we
mouth.
can't have dry mouth sounds.
Caro, our lovely editor, has told us. I didn't know. I know a dry mouth exists, but I was like,
It's
you
probably
can hear
me.
dry
Like I
mouth?
feel like I do probably like sound
I'm
like a cow.
gonna send you some mints, some
I don't know
mints
about breath.
tonight.
It's just like it does get dry
Lubricate.
when I'm yapping it up.
Yeah. Okay, so we can remove the gallbladder. It doesn't impact anything significant. It sounds like it's a usually 2-day procedure. I know you're not a surgeon, but what do you guess? It's like in and out. What are we talking about?
I think it depends. Like I think if it's totally elective, you probably don't even need a night in the hospital. Like it's probably
Okay.
outpatient.
And if you do have gallstones and you feel it, get to your GI or primary care physician
Yeah, I mean,
and the
I think
treatment.
obviously starting with a primary care physician is always the way to go because they
Mm,
can, the most important step is checking your labs, making sure there's no sign of infection, blocked duct, things like that. And then also the best bang for your buck test for your gallbladder is an ultrasound. So it's where they put the probe
Hmm.
on your, kind of like the probe with the jelly right up in that right upper quadrant, and they can take a look. You can also see the gallbladder in other imaging modalities, like you can see it in a CAT scan, you can see it in an MRI. So it's a nice organ because not all organs are visible on all studies, but the gallbladder is. But the best is the ultrasound.
Oh, okay. I'm really grateful they got the warm gels now. Like it
Mm-hmm.
used to be very cold. Now the gels are warm and you're like, "Oh,
It's not a
that's
spa,
nice."
Sonia.
The lights are dim, the nurse is there trying to relax you, and you're just like, ah. Well, anyways, that's my experience with ultrasounds, but I've never had my
I like
gallbladder
this.
checked.
Like when you have chronic illness, what do you consider a spa? Warm ultrasound
Mmm.
gel.
Yeah. Or UCLA gives booties, and then St. John's and UCLA had a pump where if we were in our paper bags, that outfit we're required to wear, which really could, like the shit kit, it really needs a rebrand. Like that, whatever it is, does not feel make any of us feel good. But UCLA had like warm air pumping through. I don't know, it was some project that the med students worked on, so I would be heated. It'd be nice and warm and
Oh,
toasty.
like in your gown?
Yeah, in my gown.
This
Yeah,
wasn't like
like that's
there's
our
like something called a bear hugger. That's like you can blow like warm air when someone's in like a bed in recovery or something.
it was before. But that's a really good question. I try to find spa-like moments all during my procedures and checkups and that's the little things that count. It's those little things that help you alleviate some nerves. I'm trying to think if there's anything else. When they give us a juice box after, I'm pretty excited, like a 3-year-old. After the
We've like
scopes.
upgraded to Diet Coke. People love a crispy Diet Coke.
What? Stop it.
I know. Crispy cold
Ooh.
Diet Coke after a colonoscopy, people are in heaven. I know I'm
Oh,
not sure if
that's
I
a
should be like
new
promoting
one.
Diet Coke because it's like chemicals and the whole thing, but like dang is a crispy Diet Coke good.
We usually get crackers and a juice box, like those little ones. I feel like I'm in preschool again. I'm like, juice
There are these
box.
cookies called Lorna Doones, which are shortbread cookies, and they're very common in hospitals. I'm not really sure why, but it is notoriously the cookie that all like hospitals and surgery centers, we all give like Lorna Doones. It's such a bizarre thing because like shortbread cookies really don't exist much outside of that, but they're so delicious.
Oh. See, I'm a brat. I used to live in London. You went to Europe, didn't you?
I've
Didn't you
been a
go to
couple of
London
times,
last
yeah.
year? Yeah, I sent you a list. But my favorite are like the Waitrose Scottish shortbread cookies because there's all this butter. A lot of butter. I know butter is like a fat. I know
Yeah,
it's
it's not
probably
good for
not
your
good for
gallbladder.
me.
Now you know that.
I know, but there's something about just probably because we used to make ghee, clarified
Mm-hmm.
butter, growing up, and I would then lick the paper as my grandma would make
Mm,
fresh ghee. But the Waitrose ones are good, and then Kerrygold butter is my
so good.
go-to butter
I
right
love
now.
Kerrygold.
So good. Which is what you shouldn't be eating if you want to protect your gallbladder all the
Correct.
time. But when you want to cope with the world like I do, have a teaspoon of butter a day. Um, okay, so we've talked about the gallbladder. Now let's talk about the liver because there's so many things associated with the liver. Like there's a fatty liver. I'm all like, why are you giving shade to the liver and calling it fat? Like, let's just
Yeah.
start with like we mentioned what the liver does and what are some things we need to be mindful of with our beautiful liver.
Yeah, so I think fatty liver is super common. And I tell people fatty liver just means that there's deposition that looks like fat in the liver. The liver can't really tell the difference between or at least imaging can't tell the difference between a lot of deposits. So I tell people like if the liver doesn't like it, it's going to look like a fatty liver. So fat, which can be anywhere in your body, visceral fat can be in your abdomen, in your butt, it can
Mm.
also deposit in the liver. And it's much more likely to deposit in the liver in people that have that body type, that apple body type, where they have a lot of fat in the central core versus those that are more pear shaped or anything like that. But regardless, that's what fatty liver is. I do want to make a point though that just because it says fatty liver on the ultrasound, or heterogeneous liver, or something, hepatomegaly, which is big liver, all of that doesn't necessarily mean that you have just fat in the liver from fat. It can mean
Mm.
that's anything deposited in there. So, for example, if you have hepatitis C or hepatitis B, that can
Mm.
look like fatty liver. If you have alcoholic liver disease from drinking too much, when you drink
Mm.
too much, alcohol deposits into the liver and it looks like fat. So, all of these other things that can cause chronic liver damage look like fatty liver. So it's very important for you not to just assume that it's just I'm fat, fatty liver, but rather get it worked up to make sure that you understand the cause of the deposition of fat into the liver. And so that's like point one about fatty liver. The second point is it's very important to understand the two parts of liver problems. And I kind of break it down like when you have fatty liver, for example, you want to know how much inflammation is going on and how
Mm.
much scarring is going on. Because when the liver gets fat deposited in it, it doesn't like it. It's like, why is this in
Mm.
here? This is pissing me off. And it gets
Mm.
inflamed, right? Like if you were to get a piece of sand in your eye, right? It doesn't like it. It's like, what is this foreign body doing in here? It gets red, it can get inflamed, right? And so that's what we call steatosis, inflammation. That and there's a scan called a fibroscan where it gives us what's called an S score. And steatosis, many times when you have inflammation, that's when you see liver enzymes rise. So some people will say, oh, on my blood work, my liver enzymes were high. My AST,
Mm.
ALT were high. And that is generally, like I call it the poor man's marker, AST, ALT of inflammation. They're a sign that there's inflammation going on in the liver. It doesn't necessarily mean anything else other than that. It doesn't tell you the cause, it doesn't tell you the severity, just inflammation. And then over time, inflammation in and of itself is not really the biggest problem. The problem is when that inflammation forms scar. So the body's natural response with time when there's inflammation is to form scar, right? So if you have like a big cut on your arm, right? Like
Mm.
I've used this analogy before for other things, but like a road rash, right? Or a big deep gash. What would your body do to heal it? Yeah,
Scabs.
it forms scar, right? But we already talked about that the liver's main functionality is that it's a filter, right? And so
Mm.
if your liver is starting to lay down scar and what we call fibrosis, that's when it becomes a problem because that's when things stop being able to be filtered. That's when things back up. That's when toxins build up. There's problems with blood filtration, problems with passageway. And that's over time, your fibrosis score, so F0 being none, F1, F2, F3, F4, F4 meaning the most severe form of fibrosis is equal to what we call cirrhosis, meaning that's the
Mm.
end game, right? That's so much scar has been laid that it can't be reversed. And so it's important to understand with fatty liver, one, why you have fatty liver, two, where are you along the spectrum, right? So we do something in our office called fibroscan, where kind of like the ultrasound, we lay a probe over the patient's liver, but instead
Mm.
of looking at a picture, what it actually measures is stiffness. So
Mhm.
it uses sound waves, and however fast they bounce off the liver, that's how much stiffer it is, right? And so we want lower scores meaning less stiff, meaning less fibrosis. But it's really important to know where people are along that spectrum when they have fatty liver disease.
Okay, we've gone from apple. I kept thinking like you said, apple shapes, apple bottom jeans, and now sonar waves for the liver. That's
Man, girl,
pretty
I think
cool.
you're hungry and want to go shopping.
Maybe I just like that song, apple bottom jeans, because most women they're like, "What shape are you? Are you apple? Are you pear? I don't know what the other ones are." And I'm like, "I don't know what shape am I?" Same with your face. I don't know what face like. Now with AI, I'm sure they'll have it all addressed for us by scanning our faces. But it sounds like it's part of your GP exam once a year to just do your labs and make sure your liver function is going well.
It should be.
Yeah. And just because you have fatty liver, you have to get to the root cause of what is causing it so you
Right.
can eliminate it from your diet if it's eliminable, if you can
That's
eliminate
right.
it.
And if it is found to be what we call, well, there's a million names for fatty liver disease. Um, it's been called a lot of things over the years. I think the current words are MASLD, which is metabolic associated steatotic liver disease. But that sort of incorporates that not only is it fat, but if you have other metabolic risk factors like insulin resistance,
Mm.
diabetes, lipid problems, things like that, that increases the risk of fatty liver. So if your liver, fatty liver, is found to be secondary to MASLD, or basically fat in the liver, it is important to know that, weight loss is the number one treatment for that, because losing fat in the body decreases the amount of fat in the liver and thereby
Okay.
decreases the risk. And there are actually like statistics that say 5% of body weight loss improves steatosis, inflammation, and 10% of body weight loss can actually reverse your fibrosis score
Mm.
by at least a point. So remember when I was saying like F2, F3, so you can go down a whole point of scarring just with the 10% body weight loss. People ask me a lot like, well, what kind of diet should I do? Like calorie counting, exercise, keto, GLP-1s. And I tell people like it doesn't matter. There's studies that show it doesn't matter what kind of
Mm.
diet you go on. The only thing that matters is that you lose the weight,
Mm.
which is
Fair.
easier said than done, I know. But the proof is in the pudding that there's actually reversal of both inflammation and fibrosis skin. There's also, this is kind of new in our world. There's some new medications out there called antifibrotics.
Mm-hmm.
And those medications are newer, but they're really proving to be super amazing and helpful, because even with weight loss, sometimes people are not improving their fibrosis scores. And we need to keep them away from F4. We don't want cirrhosis, right? So these
Cirrhosis.
medications can actually reverse scarring, which is really kind of a new concept
That's
in medicine.
huge.
Yeah. And
Yeah.
so these are really kind of what's big right now.
This is new for me. I didn't know there was a correlation between your weight and then the weight of your liver.
I knew you were
Um,
going to like talking about liver.
yeah, I do. I just know that when I was a kid, they'd always be like, "Eat more liver for iron," and I'm like, mm,
Well, it's
can't do
true.
that.
Like the
No feeling.
liver, our liver is an iron repository. So we store a lot of iron in our liver.
Mm.
And so when you eat other animals' livers, they also have a lot of iron in them.
Really? So if you're a vegan or plant-based diet, how do you get it?
There are vegetables and stuff that have a lot of iron. So, like spinach and kale are very high in iron. There's some other root vegetables, but a lot of vegans and vegetarians even do need to supplement with oral iron in
Mm.
vitamin form.
Yeah, I think I have that. I had anemia a few times. They put me on the pills and then I had an infusion once, twice. That was all right.
Well, yours is probably from malabsorption. So, you can have low iron from a variety of reasons. You can have it from not getting enough. so you're not
Mm,
eating enough dietary iron. You can get it because you're losing iron. So, like, let's say you have super heavy periods, right? You're
mm,
or you're having a gastrointestinal bleed from a tumor or an ulcer, you're going to lose iron that way.
mm.
Or you cannot be absorbing iron. So iron is absorbed in the small intestine mostly, so in the duodenum and in the terminal ileum, where Crohn's disease and things like celiac disease very much affect. And so if you don't have the mucosa and those little finger-like villi, which
Finger
we've talked
hairs.
about previously, to absorb the iron, then it doesn't matter how much you eat, or how much you take in, you're always going to absorb less. So a lot of patients with malabsorptive disease, like inflammatory bowel disease and celiac disease, need to get IV vitamin infusions for that reason.
Yeah, I think a couple of times I was looking yellowish. Is that? I don't know why I was looking yellow. Maybe that was just my skin tone,
Yeah,
but
I don't know. When Indian people get pale, do they get yellow?
that's a good question. I'm considered a mocha, so like a I'm not sure, but I'd be like, Dr. Ha, why am I turning yellow? Is it my liver? Because I always associated people turning yellow with liver, and I don't know where that came from.
Um, would you like me to answer it?
I would love to know.
I'm not sure. I wasn't sure if it was rhetorical. So we have talked a lot about the liver. One of the things I mentioned earlier about bilirubin, so I mean, about bile ducts. So bile is made in the liver and then secreted
Mm.
through the what's one of my favorite words in medicine, canaliculi, through the liver. It goes through the canaliculi. I feel like I did not, just like a side
Canaliculi.
note, everybody, I did not prepare for this. Like, I am doing this off the cuff, and I am remembering the word canaliculi from anatomy and physiology in medical school, which was in 2000. That was almost 20 years ago. Okay, 2007. Like, what the heck? So, anyway, just like genius level here. But regardless, canaliculi and goes through the liver and, through the smaller bile ducts and then eventually into the common ducts and gallbladder, whatever. But if you have fibrosis and scarring, they start blocking off those channels, right? And so when those channels, bile duct channels, get blocked or kinked or scarred down,
Mm.
bile builds up. And so when bile
Mm.
builds up from blockage, either from cirrhosis, like so much scar, or from a big stone stuck in that duct that's gonna piss me off in the middle of the night, the worrisome sign is that the bilirubin goes up, which is
Mm.
the other lab test that's seen on liver function, because bilirubin is a reflection of bile. And so bile
Mm.
building up elevates the bilirubin. So that is, bilirubin being up is a sign of blockage of those ducts. And
Mm.
so when
So,
bilirubin goes high, you get, remind me, Sonia, what color is bile?
yellow?
And so what
Like
color do you turn when your bilirubin goes high?
yellow.
Dun 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 dun
Yellow.
dun dun.
Uh,
Come on, that was like really big. I feel like
I'm
that
still
was
on the word can. I'm still trying to figure out how to pronounce canalic. Yeah, see, I can't even. I've written it down. I'm like, I still can't pronounce it, but that's
canaliculi.
okay. Yeah, the way you say it is like with a little Hollywood accent,
I feel like I should be saying it with like a flamenco dancer's
Canaliculi.
outfit or something. Canaliculi.
Canaliculi. Okay, yeah, I'm still on that word. Okay, but that's why we turn yellow.
And we're back to the
Or it
beginning
can.
of yellow.
Yeah,
Yellow bile.
yeah.
We've come full circle.
Yeah, Dr. Luthra was like, "Don't give me a hug. I just came back from the clinic and I've got bile all over my scrubs."
Yeah,
And,
so Dr. Luthra is one of those physicians that if you're listening to this, Anjali, you're going to love my comments, because she is a specialist in somebody that deals when the gallstones are stuck in the bile duct. That's like a Dr. Luthra problem. It's not a Dr. Soyka problem because I don't do that procedure. But like I have to phone a friend like Dr. Luthra and be like, and of course that's another thing that always is like midnight or a weekend. Um,
of
but
course.
yeah, so she's always covered in bile because that's what the job that she does. She's always in those bile duct systems, and she knows all about canaliculi.
Canaliculi. There, I said it. Canaliculi.
I'm proud of
Okay,
you.
with your little accent. I know. Big steps for me today. Big steps. Any other ailments associated with the liver that we should be mindful of?
I mean, I think it is, to throw in there that everybody should get a one-time test for hepatitis C.
Mm.
Hepatitis C, we've come a long way. I mean, incredible lengths in hepatitis C. Hepatitis C is now essentially a curable disease in 8 to 12 weeks, which is wild because it was killing hundreds of thousands, if not millions of people. And now it's like
Mm.
pneumonia. I don't know. It's a hard thing for my brain to process where we've come in hepatitis C. So, thank you to all the drug researchers out there who have made curing disease possible because it's been a wild
Mm.
ride. And I still remember, I know we're running a little over here, but I want to tell this tale because it means something to me. And I think a lot of people know people who have been affected by hepatitis C, but I was a med student and I got a needle stick from an IV drug user, and I had to go to the infection control and get tested. And they put me on this thing called PrEP, which prevents you from getting HIV, as we didn't know the status of the patient. And I remember thinking very vividly in that moment, praying that the man, if he had anything, had HIV, because I didn't want Hep C so badly, because
Mm.
hepatitis C was such a death sentence. And now, I mean, if I wouldn't even care, it's so curable. And it just goes to show how important research and drug development is, because this is truly what can happen, is an actual cure for a disease that was killing people. So props to those
Preach.
people. But yeah, everybody deserves
Yeah.
a one-time screen for hepatitis C. You're much, it's before, the 80s, we were not screening blood products. So if you had a blood
Yeah.
transfusion before that time, you're definitely at risk. Um, but it's also transmitted, through blood and sexual contact. So, if you're sharing needles or getting risky tattoos or practicing risky sexual practices, you need to be tested for Hep C regularly. Same with, and you should get tested for hepatitis B as well. And if you don't have it, there is a vaccine against hepatitis B
Mm.
that is very effective, and you should make sure that if you're going to be on any biologics, or if you ever need chemo or any immune suppressants, that
Yeah.
you do get vaccinated against
You get
hepatitis B.
tested. Yeah, there
Um,
was a big story about Gilead and how they helped Egypt because I guess there's a lot of my Egyptian friends were educating me about how Hep C became so prevalent out in
well,
Egypt.
yeah, in Egypt there was a specific variant. I actually forget now. Genotype 3, I think, it was 3 or 4 that was
Mm.
very unique to Egypt, and it was very difficult to cure. And Harvoni, I think, was the first to come out and be able, which I think Gilead developed. I hope I'm not misspeaking in this, but I think it was that drug that came out that was able to actually first sort of penetrate that genotype
Mm.
of Hep C, and it was miraculous.
Yeah, and the price point at which they introduced it to Egypt was very more than fair, so that the whole population could have access to it. Um, that was a yeah.
So
I
yeah,
don't
I mean, I
know
think we
which
talk,
drug.
and so viruses like hepatitis are a common one, and there's rarer causes of liver disease. So there's something called PBC, PSC. There's iron deposition diseases, something called hemochromatosis, which is a problem with iron deposition. Um, really rare diseases, and like Wilson's disease, which is like, if you like House, it's probably been an episode of House or something like that.
It's a good
It's like
show.
from copper depositing in the liver. There's autoimmune liver disease, which does
Mm.
increase risk of autoimmune liver disease when you have other autoimmune diseases like inflammatory bowel disease, or also seen increased risk in celiac patients. So there's a
Mm.
whole host of things, but see your local GI. We know. Let us work you up
Mm.
if you need it. Don't do drugs. Practice safe sex.
And be mindful of how much fat you're depositing
Yeah.
in your gallbladder and in your liver,
Yep.
at least in your liver. Yeah. This has been, as ever, informative. I hope our viewers and listeners enjoy it. And until we meet again, which is Monday. So,
Perfect. I
mwah. See
can't
you
wait.
later, Soyka.
Happy weekend, if you're tuning in when we drop this episode on a Friday. I hope you all have a wonderful weekend. If it's you're listening to this late, I hope you got a laugh and some knowledge simultaneously with us.
Yeah, and a reminder to comment, subscribe, let us know what questions you have that we can answer or on any of our platforms, Spotify, YouTube, Instagram, Apple Podcast. I think I got them all this time.
Nailed it.
But it's a pleasure rolling with you. So thank you.
See you next time, Sonia. Peace out.
Bye.